Good evening. This is Dr. Rich Lee, and I'm recording this video at a place called Sorensen's Resort, which is in Hope Valley, California. Hope Valley is an alpine valley east of the crest of the Sierras, and I've been coming here now for 50 years, starting back when I was just 19 years old, working as a backcountry ski guide and cross-country ski instructor. I'm here doing the same thing. I'm not teaching, but I'm enjoying going up into the hills and skiing in the backcountry up to 9,000 feet and still able to breathe at the tender age of 69. This talk is about altitude adaptation. In fact, altitude is the name of the company from these YouTubes are being produced. The motto is to get your mind and body to a higher level. This talk is about at least getting your body to a higher level and tolerating it well. Altitude adaptation is basically the process, first of all, of avoiding a condition called acute mountain sickness, or AMS. Now, AMS is kind of like a hangover, has the similar symptoms of lethargy, headache, poor concentration, poor sleep, maybe some nausea, and poor appetite. These are similar symptoms to a hangover, and some of the causes are somewhat similar as well. This is a more common problem for all these people who are coming up here in the mountains to ski. They work hard all week. They get off at 5 o'clock. They try and get packed and maybe hit the road at 6 to 7 p.m., and that 4-hour drive can become a 6-hour or 8-hour drive because of traffic or chain controls or crashes or closing the roads temporarily for avalanche control. So they tend to get at their destination about 2 a.m. and then they want to hit the slopes at 9 a.m. They've got very little sleep and it's not very good sleep. Oh, here's one thing I use to actually track sleep. It's called an Oura ring, and I only wear it at night, and probably its best function is to simply remind me to get to bed earlier. It does record things such as oxygen saturation, heart rate, how many times you get up and move around. So it gives you an idea of the quantity of your sleep and the quality of your sleep, and theoretically, how well you might face the day. Well, if you're sleeping poorly, then you're more prone to get acute mountain sickness. Another problem is while you're sleeping, you're also breathing more rapidly because there's less oxygen. Now, when you're breathing more rapidly, you're also losing water vapor through your breath, and you're becoming more dehydrated. Air in the mountains tends to be drier. Being hydrated is very important. So when you're there or even on your way there, drink up. And dehydration is also a cause of the symptoms of hangover and certainly one of the contributors to acute mountain sickness. Talk about breathing rapidly. A common medication a lot of people get prescribed when they're going to much higher altitude, say the Andes or Himalayas, is a drug called Diamox or acetazolamide. Now, when you're breathing rapidly at altitude to get more oxygen, what happens is you're blowing off carbon dioxide. Carbon dioxide, or CO2, is what stimulates the brainstem to regulate breathing. So if you blow it off, all of a sudden you slow down or stop breathing. And this can be a real problem when you're sleeping because you're breathing rapidly, you stop breathing, the CO2 gradually rises, but by the time it does get back to where it stimulates your breathing, your oxygen level is very low, you wake up gasping for air. So drugs like Diamox are meant to acidify the blood so that it's more like having a steady state of carbon dioxide, and theoretically you have less of what we call this periodic breathing. So you're less likely to wake up gasping. However, you're more likely to wake up and having to go to the bathroom because Diamox is also a diuretic. So that's a prescription that's commonly used. There may be some things that are simpler that you can do. First among those is simply ibuprofen or 1 Advil a day. And this is, again, tested in a randomized double-blind clinical trial. About 200 milligrams does help reduce the symptoms of acute mountain sickness, possibly through anti-inflammatory effects. But it's also nice because it helps reduce the aches and pains of doing your weekend warrior thing. It's also been used and shown to be very helpful in what's called high-altitude headache, which you can have without the other symptoms of acute mountain sickness. Moving on, I've been reading up more on this lately and have discovered a lot of evidence on a supplement called CoQ10 or coenzyme Q10. Now, CoQ10 is in all of our cells, and it's a rate-limiting enzyme to convert energy from any food source into energy. And apparently, the evidence shows that taking 200 milligrams at altitude will improve acute mountain sickness. Better to start it a day before you ascend. Now, this can be a real problem for people who are taking cholesterol-lowering medication called statins. Statins lower LDL cholesterol, but they also significantly lower CoQ10. This might be part of the cause for people getting fatigue and muscle aches from being on statins. So they should definitely be on that, probably 100 milligrams a day, and definitely if they're going to altitude, 200 milligrams a day. It's a little pricey. Make sure if you buy it, you get it from a source that's GMP certified, which means it's almost pharmaceutical grade. Another supplement out there that's had strong evidence in reducing symptoms of AMS is ginkgo biloba. Now, ginkgo biloba is an extract from the ginkgo tree, and as a supplement, it's been used for a long time to improve blood flow to the brain. But it also seems to have other mechanisms that reduce the symptoms of acute mountain sickness without the need for taking Diamox. Ginkgo biloba, the dosage, remember, is 60 milligrams taken at least a day before you ascend. And you can take this all together with Advil and CoQ10 and rest and hydration, and you've got a good combination of things to prevent acute mountain sickness. There's one other supplement called rhodiola. Now, rhodiola is an extract from a plant, and they're not sure how it works. There's some theory that possibly it will actually pull oxygen out of the air at lower pressures, which occur at altitude, and deliver it to your blood, and then deliver it from blood to your muscles. This is the same type of process that occurs actually when we're fetuses, because oxygen is coming through the placenta at a much lower concentration. It needs to be pulled into our bloodstream and delivered to the muscles. And to do that, the body has what's called fetal hemoglobin. We actually have, to some degree, to create that again if we spend a great deal of time at altitude, say 15 to 18,000 feet. What happens when that occurs, and you have to be there for about 90 days because that's how long it takes for your red blood cell population to turn over. So if you're lucky, those new red blood cells will have fetal hemoglobin, which will pull oxygen at lower pressures at high altitude and deliver it to your muscles. There's actually a genetic variation that makes that happen. And I've looked at the DNA of over 500 people and found it to be present about 25% of people. This mutation is one that will greatly increase the production of fetal hemoglobin after 90 days of exposure to high altitude. And this is probably the reason why people like Ed Viesturs and Reinhold Mester, some of the most accomplished mountaineers, had the ability to climb mountains such as Everest at over 8,000 meters without oxygen. It's not that they're superhuman, they simply have this nice little genetic variation. Those are all things you can do without a prescription, either any of them or probably all of them, to improve your functioning, your adaptation, altitude, and prevent acute mountain sickness. Now, this hat is from the 1999 Everest Millennium Expedition, and I was the base camp physician then. That was 25 years ago. One medication we brought there, a drug called Viagra, which is known as a PDE5 inhibitor. Viagra is obviously used for male erectile dysfunction, but variations have also been prescribed for reducing high blood pressure in the lungs. Now, high-altitude pulmonary edema is a similar situation where fluid starts leaking from circulation into the air sacs of the lungs, and they're filled up with fluid and blood, and it's a bad situation. So we brought Viagra to Everest Base Camp to prevent that or even treat it. Fortunately, we had no climbers who came down with high-altitude pulmonary edema. In fact, we didn't take it otherwise for other reasons, and we know now that there is a reason, but it did work well for bribes. Anyway, what works better than Viagra in the same class of medications is tadalafil, aka Cialis, and typically in a much lower dosage of about 5 milligrams. It also has a benefit that, unlike Viagra, it works if you take a high protein or high fat meal, has less chance of symptoms of congestion or visual disturbance. So far, about 99.9% of my patients who've ever been on it for any reason, a growing amount now for altitude adaptation, not complained of any side effects. So this is the guy, Cialis, aka tadalafil. Typically 5 milligrams is all you need to prevent or significantly prevent the risk of acute sickness. It also seems to improve with oxygenation across the blood-lung barrier, even as low as 6,000 feet and possibly higher. If you do come down with high-altitude pulmonary edema, in which case you're hopefully with an expedition because you're much higher altitudes, 20 milligrams of this a day can possibly save your life, but still the most important thing is to get down. Anyway, so that's the story on altitude and altitude adaptation, preventing acute mountain sickness, and in hopefully never coming down with high altitude pulmonary edema. So back to the basics: rest, try and get some decent sleep. Don't try and hit the slope so early. Sleep longer if you need to. Hydrate well, either with water or with electrolytes in particular, and keep it going. Third is simply 1 ibuprofen or 1 Advil a day, about 200 milligrams, and again, starting before you ascend. Next is CoQ10 or coenzyme Q10. It's a little pricey, but 200 milligrams seems to do the trick according to the randomized double-blind clinical trials. Next up is ginkgo biloba, about 60 milligrams a day. You might look into rhodiola as well, but the evidence seems to be stronger for all the other things I've mentioned. And if you can score some real Cialis or tadalafil, be careful online because what you may be getting is counterfeit, hopefully not fentanyl. 5 milligrams a day, again, starting before you ascend, and all these while you're at altitude, and hopefully that'll do the job. The generic is every bit as good as a brand name, according to all the patients I've ever prescribed it. See if you can't get it from a legitimate source. But if you can't get it, at least all the other things should really help. So enjoy your time in the mountains, enjoy the tranquility there, and breathe easy. Thank you.